Introduction to Phlebotomy. Introduction to Phlebotomy. Through this module, you will explore the world of phlebotomy. We will cover all you need to know, from familiarizing you with the role of a phlebotomist to discovering the best professional and personal traits that a phlebotomist holds. Together we will find out what education and training are required to become a successful phlebotomist and how to maintain high standards of practice. You will have a clear understanding of the guidelines for best practice within the UK. Topics covered in this module. What is phlebotomy? Duties of the phlebotomist. Traditional duties. Additional duties. Professional and personal characteristics of a phlebotomist. Professional characteristics. Personal characteristics. Phlebotomy education and training. Guidelines for phlebotomy practice. What is phlebotomy? Phlebotomy is the practice of obtaining blood from a person, normally through puncturing a vein. The technique of releasing blood from the human body, or bloodletting, dates back to 1000 BC, in the times of the Egyptians. Throughout history this evolved to the use of leeches, to suck the blood out. In the past, a visit to the barber's was to have your blood collected, rather than a haircut. Thankfully, for us today, the practice has greatly changed. Phlebotomy is now a safe and sterile procedure. The most common way to obtain a blood sample of an adult, child or baby is through venipuncture, inserting specialized equipment into the vein to obtain a blood sample. The phlebotomist's duties. The role of a phlebotomist can be a varied and diverse one. The setting you work in may be changeable, from hospital to home, working with a range of people from newborn to elderly. However, the duties remain consistent. Although the main goal is to obtain blood samples, there is a process that must be followed, even under pressure. It is vital to adhere to the process in a methodical way to try and prevent mistakes being made. Traditional duties. Identification. It is vital that the correct patient is identified and prepared prior to obtaining the blood sample. Equipment. Organization and awareness of what equipment is required, correct bottles and amount of sample size to be obtained will always put you ahead. Labeling. Correct labeling is vital. This ensures the right patient gets the right interventions. Health and safety. Awareness of health and safety protocols and relevant policies ensure your patient's safety and your own. Transport. Once obtained, blood samples need to be transported to the correct laboratory in the correct way. Communication. Effective verbal and written communication, taking orders, processing information and documentation, including computer and telephone skills, are vital. Sample processing. Samples must be delivered to the correct departments in the lab. Correct sample volume. Ensuring the correct amount of blood is drawn by venipuncture or dermal puncture. Education. Attending education programs for continued development. Computer record keeping. Operating computers to keep records relevant to phlebotomy. Additional duties. As you become more familiar in your new role, you may be able to progress to additional duties. Teaching. Guiding and teaching other staff in the skill of blood taking. Participation. Participating in audits and monitoring the quality and frequency of sample collections. Specialization. Having the knowledge and ability to obtain specialized blood sampling from arteries and through a central venous catheter. Monitoring. Complete further training to monitor both vital signs and electrocardiographs (ECG). Professional and personal characteristics of a phlebotomist. When you think of blood samples, a strong stomach is often the first thing required, but with phlebotomy, as with most vocations, there are more traits needed. Working as a phlebotomist requires the ability to adapt to new situations, whether that is the environment you are working in or the patients you are working with. Communication is a key skill to have, being able to understand orders, process them and work efficiently. Professional characteristics. Team player. Being cooperative, approachable, and flexible. Organized. Ability to prioritize, be efficient, methodical, and responsible. Transparency. Maintain confidentiality, being aware of your limitations, admitting mistakes. Respectful. From appearance to manners, being respectful to those around you in the workplace and your patients. Having an awareness of cultural diversities. Communication. Clear and concise written and verbal skills. Ability to display active listening skills. Independent. Having initiative, keeping up to date on all policies and protocols, following the safest and best practice. Appearance. Ensuring that you abide by the dress code and keep work uniform neat and kempt helps to maintain a professional appearance. Cultural diversity. All cultures are different and can involve different beliefs, values and religions. Respect and understanding of cultural diversity is vital in healthcare for equality and fairness. Telephone skills. Some capabilities using a telephone are important for phlebotomists because there will be times you have to communicate important information over the phone. Answer the phone promptly, speak clearly and ensure the information you provide is accurate and reliable. Personal characteristics. Calmness. Having a calm, reassuring attitude can reduce anxiety in the patient. Caring. Showing kindness and compassion can ease the nervous patient. Empathy. Displaying empathy can provide comfort to the vulnerable. Patience. The ability of patience can ease difficult situations and resolve conflict. Confidence. Being confident in the knowledge that you have the skills required to safely obtain the correct blood samples. Awareness. Being able to identify a patient's needs and fulfilling them with a gentle nature ensures not only a safe environment, but a better experience for each patient. Phlebotomy education and training. By now, you should have a clear understanding of what a phlebotomist is, does, and who is just the right person to become one. The good news is you do not need to have a medical background to become a phlebotomist. In fact, most employees ask for 2+ GCSES. However, a healthcare assistant course is beneficial. But to master the juggling of understanding the sample of blood needed, finding the vein, obtaining the blood and performing these duties all in a calm and professional manner, can require more intensive training. Through this course, we want to provide you with the best foundation to work from. Having a clear knowledge and understanding will better equip you for the workplace. Thorough training will give you confidence in your abilities. Education will ensure safety for you and your patients. It is advisable to partake in yearly refresher courses to keep up to date with standards and policies, and be aware of improved techniques and equipment. Guidelines for phlebotomy practice. Although many medical staffs can take blood samples, the knowledge and experience a phlebotomist have sets them apart. This makes the process of obtaining and processing blood a more pleasant and stress-free experience for all. There is a universal aim to standardize practice. By standardizing practice through specialized training programs, phlebotomists ensure their practice is safe and regularly updated. Universal aim to standardize blood sampling to ensure the safest and best practice. The practice of phlebotomy carries a high risk of injury for both staff and patient. The aim of each sample taken is to follow best practice. Through comprehensive training and regular updates, the high risk can be reduced. Due to the knowledge and training received, phlebotomy staff are often more successful in blood sampling and have reduced rates of contamination. With the correct education and training, phlebotomists can achieve better blood collection, improving laboratory blood tests and collection of blood from blood donors. This can result in more accurate and faster treatment for patients. Summary. In this module, you have learned that phlebotomy is the practice of obtaining blood, usually via venipuncture. The phlebotomist has a wide and varied role, working in a hospital setting, GP surgery and patients' homes. The phlebotomist is responsible for obtaining the right blood sample along with the process of identifying the correct patient to ensure the samples reach the correct laboratory rapidly. As a phlebotomist, you are a team player who is calm and empathetic, but can thrive under pressure. Taking part in thorough training and keeping up to date with standards and policies promote best practice. Standardizing practice upholds the safety of staff and patients, whilst maintaining best practice.